Well, first off, just want to give a thanks to you, Amy, Harmony, and Bonnie for inviting us. It's truly an honor. Um, Unfortunately, I wasn't able to, but I did catch of some of what Peggy was saying, and I felt really uplifting. And it's great to hear the conversation discussing about what are the pathways for collaboration. I think that's really essential, and where the rubber meets the road. But before we begin in our presentation, I just want to have a moment to introduce the others who will be presenting, the other PAR researchers, and then feel free to turn on your video momentarily. But I'll start with Crystal Gilbert, who is currently, well, she's a PAR researcher alum. She's been a part of a couple PAR research projects, and she's currently studying speech pathology at Kingsborough Community College. Is that correct, Crystal? I believe so.
That's correct.
Great. Next, I'll introduce Mila Miza Kandova, who is a recent grad of Brooklyn College, congrats, and is a prospective medical school student, and she'll be presenting later. Next is Jeff Ogaro, who is also a multiple researcher alum, and she is a recent grad of Medgar Evers College, where she studied biology. And next, I'll introduce Ki Chan, who's been a part of a ton of different PAR projects, especially in a lot of leadership roles, and is currently studying at CUNY's Graduate School of Public Health. So now I'll share my screen so we can start the presentation. All right. So before we jump into our research, I just want to start by sharing a little bit about Wellness Empowerment for Brooklyn and how this all started. So Wellness Empowerment for Brooklyn is a team of community leaders, healthcare professionals, planners, and student researchers who've come together to address the longstanding community health issues in marginalized communities of Brooklyn. We're sponsored by Maimonides Medical Center's PPS Community Care Brooklyn, and the work is carried out or led by MIT Community Innovators Lab since 2016. And some of our other close partners include CUNY, especially Medgar Evers College, Kingsborough Community College, and Brooklyn College, as well as the East Brooklyn Action for Health and Economic Justice, the Coalition to Transform Interfaith, which helped to save Interfaith Medical Center in Bed-Stuy, and the Brooklyn Worker Council, which is a group of 1199 SEIU delegates serving in and representing healthcare workers at the One Brooklyn Hospitals, Brookdale, Interfaith, and Kingsborough. Other key partners is Brooklyn Communities Collaborative, which is a new nonprofit form to continue the work on addressing the social determinants of health, started by Maimonides Community Care Brooklyn under the district program. So, WEB, or Web for Brooklyn, we are rooted in the belief that to address longstanding community health issues is to be committed to addressing the social determinants of health, such as employment and work conditions, access to quality education, and access to adequate housing. We also believe in the importance of creating and supporting efforts that build community wealth, and last but not least, to have those that are most impacted to be centered and participate in the co-creation research and initiatives aimed at addressing issues. All of our PAR researchers who conducted surveys, focus groups, interviews, and identify community assets are from the communities in which the PAR projects take place. At the conclusion of each PAR project, research findings and recommendations are presented to the broader community at a local school or community center. So since 2016, WEB has done PAR projects in over a dozen Brooklyn neighborhoods, as shown on the map. And in that time, over 3,500 community residents have been surveyed on issues ranging from neighborhood safety to quality of housing. Over 350 community assets have been identified. Over 100 have been trained in PAR and the social determinants of health, and over 60 recommendations have been produced to address a number of issues identified by community stakeholders. In that time, our projects have led to, well, many things to be proud of, but to highlight just a few of them at different levels of impact. The first PAR that took place in Brownsville and East New York in 2016 to inspire and influence Governor Cuomo's $1.4 billion Better Brooklyn initiative to improve community health and wealth in central Brooklyn neighborhoods. That PAR as well, also well, early PAR recommendation from that first PAR in Brownsville and East New York also led to Maimonides PPS, Community Care Brooklyn, to partner with Teens for Food Justice to fund and launch a hydroponic farm at Brownsville Collaborative Middle School, which we'll talk a little bit more about later. And then to act upon the recommendations produced from all the PAR projects in 2016, the East Brooklyn Call to Action was created, which is an alliance of leaders, labor union organizers, and healthcare professionals. So the creation of WEB and doing participatory action research directly stems from the efforts in 2012 when Interfaith Medical Center in Bedford-Stuyvesant was being pushed to close from bankruptcy. Workers of the hospitals, local residents, labor union organizers, and elected officials organized under the umbrella of the Coalition to Save Interfaith to save it. After numerous months of town halls, marches, picketing, all-night vigils, and active resistance of closure, the hospital was saved by new state Medicaid waiver funding called DSRIP. After the hospital was saved, members of the Coalition to Save Interfaith, now called the Coalition to Transform Interfaith, in partnership with Maimonides Medical Center's PPS, came together to initiate PAR projects to foster community involvement in addressing community health and wealth. After the hospital was saved, the Coalition to Transform Interfaith understood there was still a pressing need to continue organizing to address community health in marginalized communities. In partnership, 1199, NISNA, and the Coalition commissioned MIT CoLab to prepare Caring for Today, Planning for Tomorrow, the need and potential to transform interfaith for better community health, which was published in 2014. In partnership with Community Care Brooklyn and CUNY colleges based in Brooklyn, in 2016, the Coalition helped launch the first PAR project, which enlisted neighborhood youth and young adults to conduct the research. For the Coalition, it was important for future efforts to be truly community-led, owned, and managed, in contrast to having outside groups coming to marginalized communities to do the research and propose solutions. So in a usual year, outside of 2020, our PAR projects begin in April, where the graduate researchers join and get oriented on the neighborhoods and start developing a curriculum for the undergraduate researchers who join in June and the high school researchers who join in early July. By mid-July, after learning more about PAR and the social determinants of health, the PAR researchers developed a guiding research question for the PAR project, and by the end of July, begin developing the research methods. In August, the PAR researchers conduct neighborhood surveys, focus groups, and have interviews with community stakeholders. In the final stages of the project, the PAR researchers analyze their research and produce recommendations and conclude the project by sharing their findings in a community report presentation held at a local school or community center in which the PAR project takes place. In addition to the community report back, there is also a report created that is physically distributed to the community and available online for viewing. So to 2020, after 4 years of PAR projects and over a dozen Brooklyn neighborhoods, and balloting efforts from the East Brooklyn Call to Action Alliance, housing was clearly the top concern and challenge for residents across neighborhoods. Housing, especially its cost, was consistently reported as a top challenge faced by our survey respondents. Some of the highest eviction rates in the city are clustered in Bed-Stuy, Brownsville, and East New York, and the Department of Health data indicates that the rates of childhood asthma in our neighborhoods are nearly twice the city average. In the summer of 2019, the East Brooklyn Call to Action Alliance conducted a balloting initiative in Brownsville and East New York, asking residents to rank their top priorities. With more than 2,000 ballots collected, health and housing, with more than 53% of respondents ranked highest. These findings guided the focus of this year's PAR explicitly on health and housing in some of Brooklyn's most housing distressed communities, Bed-Stuy, Brownsville, and East New York. So it's our aim that the work will further support the efforts of East Brooklyn Call to Action and the Brooklyn Worker Council. The findings will also inform the Health and Housing Program areas of Brooklyn Communities Collaborative, the newly created nonprofit to continue the addressing the social determinants of Brooklyn. So as shown in the PAR study timeline slides, the PAR team usually meets in person to do most of the research and engage with community stakeholders. But this year, to no surprise, was a little different. And this is how we've primarily been meeting since April. We've had all of our meetings on Zoom. And right before I jumped on, I was thinking back, like, how much time have we actually spent on Zoom since April? And roughly, I think, just for like standard set meetings, we've easily been on Zoom for like between 150 and 200 hours on Zoom. And I think we've only literally met once as a group just to play Frisbee, socially distant Frisbee in Prospect Park. So a lot of the engagement has taken place online. And I think, it's definitely been a shift, but it's just informed us more about how to advance community engagement, what are some lessons learned, and how this helps us improve our work moving forward. Move to the next slide. And based on our previous PAR findings, and as I just discussed in the past couple of slides, we landed on this question based on the conversations with East Brooklyn Call to Action and Brooklyn Workers Council. What are the most effective ways to improve health conditions, especially those that most affect health in Bed-Stuy, Brownsville, and East New York? And for our purposes, we landed on 6 major research areas: the built environments, indoor housing conditions, nitrate developments, community land trust, the Vital Brooklyn housing developments, and area median income. In addition to the research areas mentioned in the last slide, we also conducted research on the items listed on the current slide to better inform next steps partners. So who is already addressing each area? For example, local CBOs, citywide groups, government agencies, elected officials, enterprise, and others, just to get a lay of the land of what's already taking place in these neighborhoods. What bodies have the most decision-making power? Are there opportunities to strengthen the civic infrastructure? Are there wellness-based development opportunities? Are there key policies, practices, and representations that are helping or hurting this situation? What are the implications of COVID-19? And last but not least, but what can we do? So with all that being said, I would like to turn it over to Misa Kandova, who will begin giving a brief overview of the work we've done in regards to the built environment.
Hi, everyone. So the built environment, what is it? So the built environment refers to the surroundings that provide the setting for human activity. We specifically looked at food access, open space, and heat vulnerability in the 3 neighborhoods of interest: Bed-Stuy, Brownsville, and East New York. Next. So we found that Bed-Stuy, Brownsville, and East New York residents suffer from severe food insecurity, as you can see by that orange outline on the map. The lighter the area, the more food insecure the neighborhoods are. Next. So what do we do next? In order to reduce food insecurity and improve health outcomes in these neighborhoods, we need to increase the number of grocery stores, farmers markets, mobile markets, and sites for urban agriculture to provide fresh, affordable, and nutritious food. We also need to better educate the communities on nutrition, what is healthy, what should they eat to promote good health. And we also found that hydroponic farms or aquaponic farms have also been becoming popular in food insecure neighborhoods. It's a way to farm without the expensive need of soil, so the crops and food is grown directly in nutrient-rich water, which saves a lot of money. Next. And considering we began this PAR during a pandemic, we decided to look at how COVID plays a role between health and housing. So urban agriculture continues to be an essential community asset during the COVID pandemic. In collaboration with Collective Fare, a food catering company in Brownsville, and University and Aquaponic, as I said before, and Urban Farm Collective based in East New York, the Hydroponic Farm based in Brownsville Collaborative Middle School grew produce that were used to fill food boxes and prepared meals for those most impacted by COVID-19. So next, we're moving on to heat vulnerability, which is another factor that we looked at. So a lack of trees and other factors causes extreme heat vulnerability in certain neighborhoods. Neighborhoods high in poverty are also less likely to afford air conditioners, which only exacerbates this problem. So as seen by the green outline on the map, the neighborhoods we observed, East New York, Bed-Stuy, Brownsville, are severely heat vulnerable, as you can see by the dark red. As many as 3,331 people annually could die from heat waves by 2080 in New York City alone if no steps are taken to adapt to warming temperatures and reduce the emissions. So some steps we looked at to address heat vulnerability is by adding more vegetation and moving towards cleaner energy resources. And another step that we found is the Cool Roofs program. So as you can see, it's just basically painting a roof white, as you can see in the picture. By installing a cool roof, buildings can reduce air conditioning costs by up to 30% on hot summer days. And this can also reduce energy consumption and greenhouse gas emissions from New York City's building sector. And next, I will be handing it over to Key, who will be talking about indoor housing conditions and health.
Thank you, Mila. Indoor housing conditions are closely associated with many health outcomes. Exposure to asthma triggers, lead, and other conditions may increase the risk of developing many chronic diseases. Children are particularly vulnerable to poor housing conditions because some of these hazardous materials affect children differently. There have been studies that show asthma triggers such as roaches, mold, rodents are related to asthma-related hospitalization and hospital visits. We found that these triggers are overrepresented in our neighborhood. Poorly maintained housing are common in our neighborhood. Bed-Stuy, for example, has 20% of the household reported living in poorly maintained housing, nearly twice as high as the city average. Next, please. Looking at building code violation data, we saw a large percentage of households represented roaches infestation in our neighborhood. Brownsville in particular has 49.4% of households reported roaches in their home, 32% higher than the city average. The average density of housing code violation per buildings in the neighborhood is about 2 times higher than the city average. East New York in particular has 2.6 times higher code violation density than the city average. 30.2% of households in Brownsville reported 3 or more maintenance deficiency in their home, almost 3 times higher than the city average. These maintenance deficiencies could be holes, cracks, pest infestation, etc. Next, please. Overcrowding remains one of the biggest challenges in our neighborhood. This is particularly important during this COVID pandemic. Transmission between family members is one of the leading drivers of the outbreak. And it is particularly difficult for overcrowded households to keep a safe distance among family members. 16.6% of rental units in East New York were overcrowded in comparison to Park Slope of 4.5%. Next, please. Our next step should involve inviting agencies, CBOs, enterprises, and other community leaders with their community knowledge and expertise to join the East Brooklyn Call to Action for Health and Economic Justice and the Brooklyn Community Collaborative Community Action and Advocacy Work Group. We also need to support residents organizing around issues of health and housing. This includes providing education for tenants and owners, tenant right advocacy tools, providing them tools to advocate tenants' rights. We also should connect with local businesses that contract for remediation and construction. And this should be one of our next key steps. Local businesses that are committed to provide living wages, profit sharing, and unionized working opportunities should be our primary target for partnership. Next, please. Next, we are going to talk about nitrate development. Next, please. So, Best-Buy, Brownsville, and East New York combined has approximately 50,000 residents in across their 40 nitrate developments in these neighborhoods. Nitrate buildings provide much needed affordable housing, but buildings have been subject to decades of negligence, results in unhealthy, stressful, demoralizing, and often dangerous conditions for residents. Nitrate's massive budget shortfall results in even urgent repair taking months or years. Nitrate has recently instituted a privatization plan known as the RAD, also known as Rental Assistance Demonstration. It is too soon to know whether it will lead to improved conditions, but it has unsettled residents and advocates concerned about lack of accountability, gentrification, and displacement. Weariness exacerbated by lack of clarity and trust. Next slide, please. Given just how many nitrate communities that there are in our neighborhood, the nature of the challenges that they face, as well as the restriction that COVID-19 put on our research, we focus the landscape of groups, agencies that are already working on the SDOH in these developments. Some of the key CBOs or government agency institutions that serve nitrate developments in Best-Buy, Brownsville, and East New York include the CUNY, the SUNY, Best-Buy Restoration, Canberra, Rice, Borough, etc. Next slide, please. Our next step should involve connecting nitrate residents to community health career opportunity through planned workforce effort. We should explore in partnership with key stakeholders. These key stakeholders would include nitrate residents, construction and remediation experts, elected officials, union, and community leaders. The potential of resident-owned enterprise to carry out these remediation and maintenance is also one of our key next steps. We should also partner with NYCHA Department of Health and Mental Health, this Brownsville Neighborhood Health Action Center, resident leader, and other key stakeholders to carry out power-oriented efforts to improve health and housing conditions in NYCHA development. Next, please. Now we will move on to Vital Brooklyn Housing Development, and I will pass this to Crystal and Jeff to talk about.
Thank you, Key.
Thank you, Key.
So the Vital Brooklyn is a New York State investment in community health to break down barriers to health and well-being through 8 integrated programs in areas specific to open space, healthy food, and affordable housing. Having played a role in catalyzing this investment and understanding the urgent need that healthcare workers have for affordable housing, our collaboration is especially invested in the success of Vital Brooklyn affordable housing development. More specifically, because of the high cost of housing, healthcare workers are unable to live close to the hospitals in which they work, resulting in very long commute times. Healthcare workers are unable to afford the high cost of their housing, with some living out of their lockers, their cars, and others living in buildings with conditions that are both stressful and dangerous. And continuing on the next slide, we'll focus on key findings for these housing developments.
For the Vital Brooklyn project, we prepared a map and baseline data for all developments, including the address, lot number, community served, number of units, income levels, developers, amenities, and more. In an effort to identify ways to preserve affordability, we developed an online toolkit for teaching community members and healthcare workers about the potential of community land trust designations. Next slide, please.
So in regards to our next steps for Vital Brooklyn, this includes having an open line of communication with developers and key stakeholders in order to begin participatory action research surrounding construction, marketing, management, maintenance, and other important areas. And now we'll move on to our next research area, which is on the topic of community land trust.
Community land trust, why focus on it? It was noted that minority communities, such as the ones our research focused on, are facing high rates of foreclosure, high rates of rent burden, and housing costs is outpacing income. As shown by the graph, household income remains constant. However, the cost of housing is continuously increasing, especially in these underserved communities. Next slide, please. What is a community land trust? A community land trust is a nonprofit organization that owns and oversees land on behalf of a community. It emphasizes collective community ownership of resources, meaningful community decision-making, and governance. In order to combat Mayor de Blasio's unsuccessful approach to create affordable housing, like in communities like Brownsville and East New York, have developed community land trusts that are currently gaining momentum. Next slide, please. Although community land trusts are extremely beneficial, it was found that the development process may be challenging given that land acquisition is difficult, building CLT is time-consuming, and grant funding may have impacts on CLT resources and priorities. Next slide, please. It was also noted that community land trusts have gained momentum through government initiatives. Some of these initiatives include CLT Learning Exchange in 2017, Mayor de Blasio's Blueprint to Save Our City, the $870,000 fiscal year 2020 City Council Discretionary Fund, and the Community Land Capacity Building Initiative by Attorney General Letitia James. These initiatives have aided in the development of 12 CLTs across all 5 boroughs in New York City. Now let's take a closer look at Brownsville and East New York CLTs.
Since the 2008 recession, East New York and Brownsville has experienced some of the highest rates of foreclosure in Brooklyn and New York City. Additionally, over a third of East New York residents are severely rent burdened and spend over 50% of income on rent. To address residents' felt needs, East New York CLT Initiative is currently working on expanding access to affordable housing and ensuring residents' voice, as well as advocating for an end to the annual tax lien sale, which does impact Black communities the hardest. And continuing on the next slide, in a like manner, Brownsville residents and homeowners are also in need of housing support. With a median household income of only $29,000 and high rates of unemployment and poverty, Community Solutions is working to support a community-led vision for the development of Brownsville through the creation of a new community land trust. This CLT initiative seeks to develop permanently affordable housing for low-income households and ensure that residents have the power to shape the future of their neighborhood. And on the last CLT slide, we'll focus on next steps to increase visibility and support for CLTs throughout Brooklyn, which will include piloting the CLT toolkit with the Brooklyn Workers Council members to grow a train the trainers model, as well as inviting Brownsville and East New York CLT initiative leaders to be a part of the Community Action and Advocacy Work Group. And now we'll have Lawrence, which will talk, and he'll talk more about AMI.
Thank you, Crystal and Jeff. So as mentioned, an issue identified by our community stakeholders has been the unaffordability of apartments labeled affordable in new housing developments across central Brooklyn. For many of the apartments units designated to be affordable, they're simply just out of reach for many of the current residents living in Bedford-Stuyvesant, Brownsville, and East New York due to the area median income calculations set by HUD. As you can see on the right half of the slide, the median household income in Brownsville and East New York was less than half of what the AMI was for a family of 3 in the New York City metro area. In November 2019, right before the pandemic, Congresswoman Yvette Clarke introduced a bill outlining the impacts of AMI, the AMI calculation has on low-income communities in Brooklyn, and the need to reform and a study to be done to address what is a more appropriate calculation to determine what the income range is for an affordable apartment unit. In partnership with Yvette Clark's office, our next step is to convene a virtual field hearing in early next year to raise awareness and advocate for the bill. So that was a very, 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 very brief overview of kind of all the different things we're focusing on. But our general next step is to incorporate the stakeholder feedback, our findings, and to move forward with next steps to determine the best ways that BCC, Brooklyn Communities Collaborative, can support affordable, well-maintained housing and access to healthy food and fitness. Thank you, everyone. And now we will have this time for Q&A and to answer any questions.
Wow, that was really amazing. I think it's a really impressive piece of work that you've all done, and just with like such rich detail, both in terms of the data and your analysis and your suggestion for next steps. I think it's like a super concrete way to think about the impact of housing on all of these different sectors in a neighborhood. So thank you so much, all of you, for your presentation. I want to encourage attendees to please put your questions in the Q&A box. We have a little bit of time. I do have some questions to kick us off with as people are putting their thoughts together. I think most of the students working on this current PAR, maybe everybody at one worked on previous PAR projects, but I did want to ask what, like when you, before COVID, when you were doing community report backs, how did you get folks to how did you encourage them to come to hear what you learned? And do you have any lessons learned from the process of engaging the community to come learn what you learned during the process? Does should you want me to call? I can't remember which of you did. I think most of you have worked on previous PARs, right?
Yeah, everyone minus Mila has done a previous PAR project. So I'll leave that question to Crystal or Jeff.
Want to take a stab at that, Crystal? I don't want to put anybody on the spot, but I'm just really curious. How what was your process like of engaging the community to hear about what you learned?
I actually don't really know how to respond to that because I'm not in the last one, but I do know that a lot of the community was engaged when we were surveying them. So I know that that might have pulled a lot of people in, but Gretchen could also speak to this.
Yeah, you know what? Hi, everybody. I'm Gretchen Susie. I've been working on the PARs for the past 3 years, and I should have alerted you to this, Amy, but the students aren't actually part of inviting all the people to the community report back. So I can say that what we do is we invite all of our community stakeholders, especially, and target especially those who are from the neighborhoods that we're studying that year. But our community action and advocacy work group is something that's born of the first PAR, and then every PAR after that just keeps growing. So it's this alliance of all the different actors who we named during the presentation, and it's their effort to really stay together and really push along the addressing the social determinants of health effectively during, in our neighborhoods. And so in addition to inviting all of those stakeholders and all of the parents and families of the students who participate, we also, during the course of the research over the summer, keep track of people who might want to give their contact information. We can't ask anybody for their contact information as part of the survey, but they can give it to us in case they want to be invited back. So that's part of how those are some of the different audiences that we convene for the community report backs, and they're always they're always really great. We get really good advice, and we can also see people forming new relationships during them. Usually, sort of a roving, almost charrette type experience where everyone looks at the recommendations, gives their ideas, and gives their contact information in case they want to be involved or in case we have other questions about what exactly they might have meant.
Thank you. Well, then I'll ask a slightly more general question then. Just I'm really curious about the students' experience in engaging in this kind of work and thinking about the connection between health and housing in your neighborhoods, and of the various aspects that you focused on, where do you just sort of personally, where do you think we might be most likely to get the most traction, or which aspect do you personally feel is the most important to focus on if we were able to really engage policymakers to move one of these items forward? Is there one of the issues that you think should take priority?
I would say definitely community land trusts. And I know that most likely each one of us is going to have a different response, but I like community land trusts because it's a completely radical movement. So you're taking land off of the market and you're making it permanently affordable for the community, for the people that actually need it. And so to me, that is just such an amazing approach to the new era that we live in, where everything is so unbelievably expensive, and while you can continue to create affordable housing in other areas, it's not as great as just taking the land off of the market completely.
I love that. Thanks. I think it was really super fascinating to hear about community land trusts. I think it's something that not a lot of people know about. There was a related question about whether you feel like, sorry, I'm just reading through the Q&A here. There was an exchange, but whether, do community land trusts support one another in different, neighborhoods? Is there sort of a larger umbrella group trying to really advocate for more community land trusts?
Yes, Amy. So the Brownsville CLT initiative and the East New York CLT initiative, they are both a part of this larger coalition called NICELY. Well, that's the acronym, New York City Coalition for Community Lands. And I believe in the past couple of years, they've really gone in with an intention to have this exchange of information, whether in kind of, as Crystal and Jeff mentioned earlier, about there's still this need in the work to increase the visibility of a CLT as a model and as a pathway, for more permanent forms of affordable housing. What are the engagement strategies that people can share? What are the different, what are the levers that need to be pulled politically so that more dollars are allocated towards CLT initiatives, right? So they get more funding and even towards land acquisition. So there is that body that exists, and I think there has been a lot of successes in that space.
That's fantastic.
And I'll share a link to their website in the chat.
Awesome. Thank you so much. I was just going to try and type it in as you were talking, just so people would Google the name, but that would be great. Thank you. How about some of the other students involved? Do you all agree that community land trust is sort of where you feel like there's the most kind of interest, or, I don't know. Yeah.
I feel like there's interest in like everything, but I feel like since we all worked on different parts, that we're all gonna have mixed opinions, as Crystal said. Yeah, I feel like all the things we talked about were like important, if that's what you're asking. I only worked on built environments and a little on indoor housing, and I definitely feel like those are important. I would say after community land trust, because you definitely need that land, but the built environment is like such a big part of what makes communities, what affects health in communities, like food access. Like so many people don't have access to healthy foods. I think it was Bed-Stuy, Brownsville, like the bodega to supermarket ratio was like 1 to 57. So, I mean, 57 bodegas to 1 supermarket, and that's really bad, because it's like if you don't have access to fresh food, it leads to junk food almost every day, and that leads to cardiovascular disease, obesity, and it's just a direct connection. And in addition to that, we didn't really talk about healthcare access directly, like the quality of hospitals, but that also has a huge effect. And you could see that like the top hospitals or like the best care is usually always in top neighborhoods and like wealthy neighborhoods. So yeah, I think everything definitely has an effect.
Yeah, totally agreed. That's really interesting. A question earlier about the built environments that came up is, you talked about emergency food provision and hydroponics. Do you have like thoughts about like that? I guess the comment is that emergency food isn't a long-term solution, and things like hydroponics take a lot of upfront investments, and whether have talked at all about sort of the sustainability of food solutions.
I think hydroponics take up a lot of like upfront investment, as Ray said, but it's worth it in the end. And based on the research we've done, you could see that it's worth it because they're bringing food directly to the community, and it's a huge upfront investment, but the cost of making food after that is not as much as you would grow, on a regular farm. And I guess we brought up the emergency food mostly due to COVID, because that was kind of what was going on at the time. But I think hydroponic or aquaponic farms are like the best thing we found, or at least that like I found while doing this research. Yeah.
I think to add to Mila's response is also thinking about, I think one central question that we've asked ourselves routinely in this project is how does housing help to mitigate health disparities or contribute to them? And what role can it play? And thinking about housing and new housing developments. In one of the slides that Mila presented, there was a picture of a Vital Brooklyn development that showed a rooftop garden. I think one on the side, like in a side plot, that was a part of the development. And the housing infrastructure, or housing units, buildings, they have to go in with that intention to have a rooftop garden. There is just a kind of structural load issue that has to be tackled head on there. We cannot just retrofit later. That's another large challenge. So I think the point I'm trying to land with is the need just to where does our food come from? What's the food sovereignty of a neighborhood? What's its ability to feed itself? And what is the role of buildings in doing so? So there is a challenge in terms of like, can one neighborhood sustain all the nutritional needs of its people? In the current paradigm, no. But for the things that we do know about are effective in terms of rooftop gardens or aquaponics or hydroponic, we should think about like what that impact can be for people who are most vulnerable, and at what scale that we need to be thinking about to really see a large impact, and also economies of scale in producing those spaces.
I just want to make an extra comment about the cost aspect of hydroponic farm, especially in the city. The upfront cost is primarily or mainly the land price. It's really the land that you need to actually build a farm that is costing a lot of money. And I think there actually were discussion about using underutilized land in New York City to build some of these farms in like formerly industrial area. And I think this could greatly reduce the upfront cost of having community-based hydroponic farm.
Yeah, there's also a point, and hi Shari, Shari has joined us from Brooklyn Communities Collaborative. Oh, great segue, right? Brooklyn Communities Lab, or CCB, Community Care Brooklyn, Maimonides PPS, funded this hydroponic farm at Brownsville Collaborative Middle School a few years ago, which has been critical, to supporting in providing produce for these emergency meals that have gone out. looking at our city facilities, right? Like we all spend our tax dollars to go into maintaining and building these facilities that support us, wonderful schools, and looking at that as an arena of where we can utilize space for hydroponics or aquaponics or anything of that nature.
Yeah, I'll just piggyback on that. So with district funding, we supported building a hydroponic farm in a school, like Lauren said, in Brownsville. It took over some unused lab space, and it became incorporated into the students' science and math curriculum. So the students were learning hydroponic farming. The food is used in their cafeteria. They were able to send food home with the kids for their families. And there is a path to sustainability of selling some of the food and selling it both to the school and to families through discounted food boxes. So like everyone has said, the upfront investment is certainly needed, but then there is a path to sustainability, especially when you take into consideration all of the costs associated with not having food, healthy access to healthy food, and what that means for health and everything else.
That's a fantastic model. Thank you for sharing that, Sherry. Super exciting. Two other questions. One is about one attendee wanted to know if you had been aware of the construction of a national grid gas pipeline through Brownsville and Bed-Stuy, which is projected to have detrimental health effects, will divert green energy solutions. Have you guys been aware of that?
Yeah, we're aware of it. It wasn't part of our research started, but unfortunately, and we'll be paying attention to it for sure.
Yeah, I mean, one thing I just wanted to say in general, there are a number of advocacy points you've brought up, and I was thinking about this particularly when Lawrence, you were talking about the AMI related bill that Congressman Velasquez is working on. Like, if any of the attendees today want to stay in touch with you about working on any of these advocacy issues or staying in touch with what you're doing, like what's the best way for people to be in touch with you?
Well, we could put we'll put the Brooklyn Communities Collaborative website in the chat box, and then there's a stay in touch box you can fill in that's very, very basic. So I'll put that in right now.
Okay.
Yeah.
I did it.
Yeah, I'll also reiterate that, our presentation was half an hour, which is long for a presentation, but we went through it. We were just like blitzing quickly, to get through it. And there's so much information and resources we want to share with you all. And we have plans to, especially considering now with COVID and the social distance practice that we all are taking on, to have this information online. So we're hoping to have like the full report, the short form topic briefs of all the presentations that Key, Mila, Jeff, and Crystal shared today on the BCC website in the future. And when that goes live, we'll definitely share that with you all.
Okay, great. And we can be sure to, send that back out to folks who attended today so they can take a look at that. Could you talk just a little bit more about the advocacy group that continues to grow through the PAR work, and how is that also supported by Brooklyn Communities Collaborative, and sort of what's the structure of it, and how does it work?
I'll leave that to Sherry or Gretchen.
I think there are a lot of groups working on these issues that have sort of grown out organically from a lot of the district work, and the PAR has really catalyzed groups to work on this. So there's the East Brooklyn Call to Action that's doing a lot of the advocacy around this, which is a sort of standalone group, but it informs BCC. And so I think there's a lot of different groups working on this, and we work to try to convene and coordinate some of it. But I think the best way, like Gretchen said, to get involved is just to get into the mix with us, and we'll connect people to the right places.
Okay, thanks. I mean, but there is sort of this core advocacy group, right, that meets.
Mm-hmm. And what I would say about it's called the Community Action and Advocacy Work Group, and it grew out from the first PAR, where it was all of those stakeholders who were involved in the first PAR. And then they stayed, and then it grew to involve those in the second PAR and third PAR and so on. And one of the things that we found through a very intensive case study we did of the Coalition to Save Interfaith was that the PAR really, really galvanized this and kept everyone together, because there was not only this interest in a sort of community of continuous inquiry, but the presence of young people and needing to keep everything going really has brought everyone together in a way that, in my experience, is really, really unique. I mean, it's very unusual to have the resources to be able to do these very PARs that we've been able to do, and they have really paid off in terms of the length of commitment and energy that people have been willing to devote to addressing the social determinants of health, you know, reducing hospitalizations way upstream in this way.
Right. Before we close off for today, I think Bonnie also had a question she wanted to ask, and I'm going to let her close things out today.
Yeah, so thank you all so much. And I just wanted to let you know that we have an audience here of employers in healthcare and housing. And so I would love to hear from all of our students, what are your plans? What do you want to do to get into this work? And I think we might have some people that are interested.
Well, I could definitely start. I'm currently a student at Brooklyn College, and I'm a speech pathology major. And right now, on a separate project, I'm actually working on the ways in which accent bias affects clinicians within the field, and also how implicit bias actually affects Black children and how they're diagnosed with language disorders and so forth. So I think for me, it might be a somewhat of a different path than someone that's directly in the public health field, but I feel like everything is more or less related, you know? It all really comes together in terms of addressing issues that affect minorities and underrepresented groups.
Hi. Oh, sorry.
No, go for it, Grace.
Oh, hi, my name is Stephanie. I recently graduated from Medgar Evers College. This is my third PAR. As an undergrad student, I did do independent research on breast cancer and prostate cancer. So now I'm thinking, after doing all of this public health work, that maybe I could do something like epidemiology and focus on either cancer research or cardiac health.
Hi, so this is my first PAR, and I had a really great experience with it. I love working with the people, and I love presenting today. I've always been interested in like medicine and public health, so I really want to combine the two. And I'm currently interviewing for medical school, so hopefully going to medical school, and yeah, and I want to work in these neighborhoods in the future. And what Crystal was talking about, like the implicit bias, like I think that's very important, and I think that's something that physicians should be trained like in medical school. Like, you know, a lot of it is just not taught, or a lot of medical schools are trying to teach it now, or like, you know, making more of an effort to have like a humanistic healthcare approach. But yeah, it's still a work in progress, and I really want to go into that field.
Hello, my name is Kian Chan. I'm about to graduate from the CUNY School of Public Health. My major is environmental health and environmental health science. Right now, I have both. I have great interest in indoor housing environment, and right now I have both the experience of kind of a practitioner perspective and also a researcher perspective. I used to help out my dad to do a little bit of construction and renovation for old buildings. In fact, this very apartment that I'm living right now, I'm heavily involved in its renovations, and my colleagues know we have been working through the summer. I always talk about it, and right now here, and this kind of 100-year-old building that was built for more than 100 years is very, very common in Brooklyn. I'm sure everybody knows about it. You can see them everywhere, and a lot of people have difficulty managing these type of buildings and having troubles maintaining it and also renovating it. They often have very difficult problem to address, like those structural problem, as well as like small holes, mold infestation, pest infestation, etc. And for example, this building is very, very difficult for us to renovate as well. Has all kind of older standards that is very different than the modern, how the modern buildings are built. And this, and I think I want to learn more about both the neighborhood level of how these type of issues addressed through government efforts, and also at the same time I want to know more aspects from the practitioner level and to address them also myself.
That's great. Well, you all are so impressive, and we're so grateful for the work that you've been doing and for sharing it with us all. Thank you so much for being here with us.